Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, what are the WBCs in rheumatoid arthritis? See, actually, in rheumatoid arthritis, the WBC count is normal. There can be mild leukocytosis may be present in rheumatoid arthritis. In rheumatoid arthritis, leukopenia can also occur. It can also exist, and if there is eosinophilia is present in the rheumatoid arthritis, it will reflect that there is severe systemic disease of rheumatoid arthritis is going on. So if there is eosinophilia is present, then it reflects that there is a severe systemic disease of rheumatoid arthritis is occurring in the patient.
thank you and thank you for watching.